Hello everyone and welcome back to my playlist of pharmacology. We are doing this from Lippencott and today we are going to do a very high yield topic which is the drugs which are used for psoriasis. So skin की conditions हम discuss कर रहे हैं उनमें use होने वाली drugs. Psoriasis is a very high yield topic. तो होता क्या है psoriasis? Psoriasis is a chronic autoimmune problem जिसमें epidermal hyperplasia होता है and there is dermal inflammation. So that's the kind of hallmark for psoriasis, right? Epidermal hyperplasia and dermal inflammation. And it can range from mild form of psoriasis to actually disabling form of psoriasis. And I've seen a few very serious patients with psoriasis which have joint issues and there are actually disability because of psoriasis. So it's not simply a skin lesion. It is something beyond a mere skin lesion in many of the patients. It is a condition that has high, significant genetic association and it tends to wax and wane with flare-ups. So आती है, जाती है, सही होती है. Patients are happy on days, they are not happy on days. So it becomes, so इसमें flaring होती है, episodic flaring, and it can be triggered by a number of environmental factors, including stress and skin trauma. So these are two important things जिससे psoriasis के अटैक्स होते हैं. ऐसी और भी डिजीजेस आपने पढ़ी है ना मेडिसिन में, फॉर एग्जांपल एस्थमा के अटैक्स होते हैं, इस तरह सोरियासिस के भी अटैक्स होते हैं. देयर आर सेवरल फॉर्म्स ऑफ सोरियासिस with the most common form being plaque psoriasis. Plaque psoriasis is actually characterized by presence of shortly demarcated thick erythematous plaques that are usually covered by dry silverly white scales. So this is actually the scaly presentation of psoriasis. You can see the demarcated areas, right? The plaques range in size from small to even bigger plaques. In mild to moderate cases, these plaques cover less than 5% of the body. In more severe cases, more than 20% of the body. And there are therapies which are actually targeting, number one, inflammation. So you would like to use anti-inflammatory, and you would also like to take care of the epidermal hyperproliferation. So you should be thinking about using anti-metabolites or drugs which stop or decrease cell proliferation, because this is the pathogenesis, right? There is epidermal hyperplasia, so you would like to use drugs which stop this, and there is dermal inflammation, so you would like to use the drugs which stop this. So let's talk about the drugs. The first one is apremilast. It's an oral drug approved for moderate to severe plaque or psoriasis. It works by inhibiting phosphodiesterase 4, which ultimately leads to reduced proliferation or production of inflammatory mediators. So that's how it works. Phosphodiesterase 4 inhibited, and inflammation is then subsided. The most common adverse effect is diarrhea, nausea, headache. Depression may also occur. I know this is a difficult bit for all of you to remember, but that's how pharma is. A strong CYP450 inducer, and that is important because then you have to इसकी एसोसिएशन है. सो अगर ये इंड्यूसर्स यूज हो रहे हैं सच एज फेनाइटोइन एंड कार्बामेज़ेपिन, तो दे विल एक्चुअली रिड्यूस द इफेक्ट्स ऑफ एप्रीमिलास्ट. सो आपको ये याद होना चाहिए, एंड इट्स co-administration along with CYP450 inducers is not recommended, guys. Okay. Then we use a lot of biological agents. So they basically are isolated from natural sources, including humans, animals, and microbes. They can be composed of sugar, protein, nucleic acid, or complex distribution of any of these substances. The biologics approved for psoriasis are injectable भी हैं, antibody based proteins भी हैं, recombinant proteins भी हैं, and they are used to moderate to severe psoriasis, and they are fantastic drugs, right? They decrease the inflammation, they improve the patient condition. Examples include, for example, TNF alpha, which play multiple roles in psoriasis patients, including stimulation of keratinocyte. So TNF alpha say there is keratinocyte proliferation happening. So if somebody targets TNF alpha, then keratinocyte proliferation will be stopped. TNF alpha is also important for stimulation of neutrophils and release of pro-inflammatory cytokines. So therefore, you would like to block TNF alpha. So the TNF alpha blockers such as etanercept, such as infliximab, such as adalimumab, so these are all targeting TNF alpha, and they are fantastic drugs for psoriasis because they not only stop inflammation, but they also stop proliferation of skin cells. Biologics that target other cytokines important in psoriasis pathogenesis, such as interleukin 12 and 23, इनको अगर ब्लॉक करते हैं, या There are drugs which target interleukin 23. They are all in the market. There are drugs which target interleukin 17. So if you are targeting these drugs, these targets, these proteins which are involved in inflammation or cellular proliferation, so you are basically helping the patient big time. ओके अब ये सारे नाम आपको ऑब्वियसली याद रखने हैं कि TNF अल्फा की एग्जांपल्स फॉर एग्जांपल क्या हैं ब्लॉकर्स की, इंटरल्यूकिन 12 13 ब्लॉकर्स की एग्जांपल्स क्या हैं. सो दीज आर अ बिट डिफिकल्ट नेम. इसी ब्रॉडालूमैब, बस इसमें ये जो मैब है ना, दैट इज द मोनोक्लोनल एंटीबॉडी. तो ये मोनोक्लोनल एंटीबॉडी, सो दीज आर एंटीबॉडीज अगेंस्ट दैट पर्टिकुलर टारगेट एंड देन दिस इज द नेम दैट यू एक्चुअली हैव टू रिमेंबर. Okay. Though each agent has a specific potential risk and adverse effects, amongst the adverse effects they share include injection or infusion reaction, increased risk of infection due to suppression of immune system. So that poses a challenge that you are trying to suppress immune system and then you can have opportunistic infections. In addition, because they are foreign proteins, there are chances that antibodies are developed against these drugs as well. Obviously in pharmacology, when you're using agents, there are side effects. Keratolytic agents, for example coal tar, salicylic acid, they have long been used in localized psoriasis, scalp particularly. They improve corticosteroid penetration. Coal tar inhibit excessive skin cell proliferation and may also have anti-inflammatory effects because it's cosmetically unappealing. Coal tar, ज़ाहिर उसके color की वजह से, have a low acceptance rate among the patients, but these have been used to, number one, increase the penetration of steroids through the skin and also to stop cellular proliferation. Then methotrexate. It's a very commonly used, rather the most commonly used systemic therapy for psoriasis. The drug is used in more severe forms of psoriasis and the primary mechanism is immunosuppression because इसकी ability है कि it reduces DNA synthesis, methotrexate, particularly in the T lymphocytes. Methotrexate is available in oral and injectable dosages. Among the common potential adverse effects, nausea, diarrhea, hair loss, and escape, because that's a chemotherapeutic drug. So hair, all those cells of your body which are actually proliferating, such as hair or even the bone marrow, they become suppressed as well. The primary long-term risk is potential for liver damage and therefore periodic liver function tests are must in patients का treatment के start से पहले भी. And if this is the patient going to be started on methotrexate, इसका pre-start methotrexate भी LFT होना चाहिए और regular intervals पे बाद में भी होना चाहिए. It's very important. Okay. So then retinoids. They normalize the keratinocyte differentiation, basically vitamin A derivatives का ये काम है ना. Tazarotene is topical retinoid used for treatment of plaque psoriasis. Adverse effects are similar to other topical such as rashes होंगे and all these things. Acitretin is a second generation retinoid used orally for the treatment of pustular form of psoriasis. So similar to oral isoretinoid used in acne, acitretin is a teratogenic and must be avoided in pregnancy for at least 3 years after the use of the drug. So this is serious. अगर किसी लेडी ने आज ये ड्रग लेना बंद की है तो अगले 3 साल तक भाई प्रेगनेंसी का न सोचे because it has teratogenic effects for that much long time period. Serious. Ethanol is contraindicated with this agent. Another high yield point. Okay, so what you have to avoid if you are taking retinoids is number one, pregnancy, and then ethanol as well. Okay. So that concludes our discussion. No, actually, before doing that, a very important thing which we have to actually talk about is the steroids. They have been the mainstay for psoriatic patients. बहुत लंबे अरसे से steroids हम use करते हैं because of their anti-inflammatory effects, obviously. The available agents differ in their potencies. कुछ इनमें से बहुत अच्छे हैं, कुछ कम अच्छे हैं, and they are available in different forms, including solution, lotion, cream, ointment, gel, and shampoos and whatnot. Upon binding to the intracellular corticosteroid receptor, these agents produce numerous effects that can be beneficial for psoriasis patients. So they have anti-inflammatory, anti-proliferative, immunosuppressive, so all helping the patient big time. However, you know that corticosteroids have a lot of side effects as well, especially if they're used for long term. So skin atrophy ho jati hai. There are stria because the collagen is decreased, and then because of the weight and pressure there is damage and lines and stria in the skin. There are acneiform eruptions, dermatitis, local infection क्योंकि आपने immune system को down कर दिया है, hypopigmentation. These are all serious side effects. In children, excessive use of potent agents applied to a large surface area can also actually cause systemic issue. तो आप लगाए skin पे रहें लेकिन उसकी absorption से systemic issues हैं. and they can actually disturb the hormonal axis, which can lead to other endocrine abnormalities. But anyways, we always have to weigh the risk-benefit analysis, and corticosteroid still are the mainstay for treatment of psoriasis, and there are different forms. So we have very highly potent steroids, which is betamethasone dipropionate, and all these listed here. Then we have very low strength corticosteroids, including these, and you have a choice to pick up any one of them. So many of the physicians play in this particular area. If the patient respond, they are fine, and they try to reduce and go down in this step of this ladder a little down, because the less you use, perhaps less side effects. Okay. Then vitamin D analogs are also in the market. For example, calciprotein, and that's a synthetic vitamin D3 derivative used to topically treat the patient. They inhibit keratinocyte proliferation, enhance differentiation, and subside inflammation. So they are pretty good as well, right? एक और लाइन रह गई है इसमें. Calciprotein is available in the cream ointment solution and also as an ointment. Adverse effects include वही सारे जो स्किन पे लगाने से होते हैं: itching, dryness, burning, irritation, erythema. Okay, that I think concludes our discussion, yes, on psoriatic drugs. फिर अगला टॉपिक है मेल्स के लिए बहुत इंटरेस्टिंग, alopecia की drugs, right? So we conclude our discussion of psoriasis drugs here. Take care of yourself.